This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Prof, could you talk about the symptoms of blocked fallopian tubes and the treatment options?
Well, there are no symptoms for blocked fallopian tubes. What we have are symptoms of diseases that may cause blocked tubes. So blocked tubes occur because of damage to the actual tube itself, which can be caused by infections. So chlamydia is probably these days the commonest one. Obviously other sexually transmitted diseases like gonococcal infection can cause tubal blockage as well, but that's relatively uncommon in our population. So that's infection, pelvic inflammatory disease, and the symptoms that go along with that are pain, pelvic pain, and vaginal discharge, suggesting that infection may be there. So that's one cause, infection. The second major cause these days is endometriosis. So endometriosis is where the cells that line the inside of the uterus end up growing outside the uterus around the fallopian tubes and the ovaries. So each month, those cells go through the same processes as a normal menstrual cycle. So they break down and bleed every month. So you're getting bleeding internally. Bleeding causes inflammation. Inflammation causes adhesion formation, scar tissue formation, and that's what blocks the tubes. So what we get in endometriosis is the symptoms of endometriosis, and blocked tubes are one part of that abnormality that can occur with the endometriotic disease. So that are the two main reasons why people get blocked tubes. There is probably a small group of women, I believe in it, where you have temporary blockage. And that's where, if you think about the fallopian tube is only 1 millimeter in diameter at its narrowest point, it's not surprising that we can get plugs of mucus, because around ovulation there's a lot of mucus around, and that can sit in that 1 millimeter diameter tube and dry up, and as we all know with our noses after colds, you can get a blockage. And one of the standard investigations we do for infertility to check whether tubes are blocked or not is, these days it's called a hycosi, where under an ultrasound guidance, we push fluid through the uterus, through the fallopian tubes and out the other side. And interestingly, in women with unexplained infertility, in the 3 months after having the tubes flushed through, there's an increased pregnancy rate. And we believe that probably what we're doing when we're flushing the tubes is getting rid of those mucus plugs.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.